Hey guys, this is Riaz. Welcome back to Brand Medic MBBS. I'm a second year MBBS student in Mandibular Medical College, Chennai. If you are new to this channel or new to this video, subscribe the channel and like the video. Don't forget to do that because if you are doing that, of course, I'm gonna post a lot of more videos which you will be like, which is more helpful for you for the next 1 year of your first year MBBS. Important questions, essays, wherever you have to wherever you will find difficulties, which the areas you need to focus, everything I'll be posting in this channel. So in this video, we are gonna see the basics of anatomy. Why this video? The question mark. Actually, the anatomy is a subject where more students will find difficulty in reading that subject. Many students will be, of course, failing in that subject because of the reason. Actually, if I want to say, I do fail in the first exam of anatomy. Okay, it's of course failing in MBBS exams are a commonest thing, so no need to worry about that. But I'll tell you one thing: when you understand the terms and terminologies properly, anatomy will be easy, and your dissection, that is dissection. Some people will be calling it as dissection. People will be calling it as a dissection. That's very important in your anatomy. Okay, so I'll be telling how to study anatomy, how to ace your preparations in anatomy, and what to do, what not to do. This everything I'll be saying in this video, and the basics of anatomy, where you should know and must know terminologies. You should know these things to cover your anatomy properly. So come, let's go into the video. So I just brushed up a little bit of Gray's anatomy. Even during my studies, I didn't saw Gray's anatomy not even once. But for this video, I took anatomy, Gray's anatomy, and saw the Gray's anatomy. What is anatomy? The first term. What is anatomy? According to Gray's anatomy, Gray's student's anatomy book, it is saying that anatomy is a subject where you deal with like the body parts. Ana means body. Ectomy means cut. Okay. If you see, Gray's anatomy tells that anatomy is a word derived from a Greek word feminine. Feminine. What is that? What is the word feminine means? It's called like, it means to cut. Okay, you are going to cut the body parts and see the body parts. There are two types of major two types of anatomy is there according to Gray's. One is gross anatomy, another one is microscopic anatomy. It's according to Gray's. If you are going through BDS, okay, actually BDS is giving another type of classification. We can see that here. So come here. If you see, according to BDC, it is gross anatomy. First thing, gross anatomy is again subdivided into two parts. Gross anatomy is again subdivided into two parts here. One is our cadaveric anatomy. Cadaveric anatomy. Cadaveric anatomy. Another one is living anatomy. Living anatomy. Okay. So, what is cadaveric anatomy? This is the cadaveric anatomy is a thing you are going to study in your colleges or universities, wherever. So, you are going to study the whole anatomy through a cadaver. What is a cadaver? It is a dead body which is being embalmed. What is embalmation? Like embalmism, there's a term called embalming. If some person is dying, they will get the consent from the person before they die, or else they will get the consent from the family members and get their dead body. Okay, after getting the dead body, they will be cutting that the medial part of thigh, where you will be finding femoral artery. Most commonly used thing I'm saying, most commonly femoral artery is taken, or else other major big arteries are taken. They will be inserting formalin into the artery, like formalin pipe is inserted. I guess I don't know whether I'm correct or not. What I saw, I'm saying. Okay, so they will be inserting a pipe inside the femoral artery, and the whole body is covered with formalin. filled with formalin. Actually, typically it is filled with formalin so that the body will not get decomposed. This is called embalming. When you are like taking the body and dissecting it, you will find lot and lot of formalin inside your skin, like under the skin, muscles, the arteries, veins, the pericardium, pleural fluids, everywhere you will like you can see formalin here. So this is cadaveric anatomy. What is mean by living anatomy? If you are studying anatomy through living beings, okay, like actual living being, it's called as living anatomy. This classification is according to our BDC, BD Chaurasia book, right? It's according to that. Next, what is developmental anatomy? Nothing special. It's our embryology. Okay, it's our embryology. So you will be studying, of course, embryology in your first year. Like it's a wait, I'll show you the book here. Yeah, this is the book for embryology, clinical embryology, Vishram Singh's clinical embryology. We'll be studying full course of clinical embryology here. So what is microscopic anatomy here? Microscopic anatomy is nothing but your histology. If you want to see that book, I'll show that too. Yeah, Yogesh Sontak. Okay, this book is for your histology book. You will be studying the tissues. The microscopic study of tissues is like histology, what cells are there, what is the structures present in a microscopic tissue, everything you will be studying in microscopic anatomy, that is our histology. Next, topographic anatomy. What is topographic anatomy? If you are familiar with the term topography, it's like surface. It's mean by like in the surface. Okay, so it's again a surface anatomy. Here, surface anatomy is not that much full. You will be not going deep into it because it's your practical part. While you come to surface anatomy, it's your practical part. You'll be like having 5 to 10 marks for it. Okay, this is your surface anatomy. It is important in your clinics where when you go to clinics, if you are going to surgery, it's like you will be drawing a point here, the exact point which the structure is actually related inside. It's the surface anatomy. We'll be studying the deeper structure, right? The deeper structure, you are like marking the deeper structure in the surface. It's an actual surface anatomy. So when you are doing surgery or if you are going to surgery postings, the surface anatomy like plays a major role here. Then radiographic or imaging anatomy, X-rays, like these and all you will be studying. Again, this comes under your practicals here. So this is your X-ray. For example, I'm saying it's X-ray, CT, everything. Okay. Then another thing is there, applied or clinical anatomy. What is this? Applied or clinical anatomy. If you are studying about liver, you are studying about liver, you are studying about like tongue. The applied anatomy or clinical anatomy is something if it's becoming abnormal, what will be the diseases? It will be disorders or diseases will be there. So if you are studying about liver, hepatomegaly. If you are studying about tongue cancer, something is there. Okay. If you are studying about like heart, you will be like myocardial infarction. Every questions of anatomy is incomplete without a clinical anatomy. Okay, it's a very important part when you are writing an essay or if you are writing even a short answer. Clinical anatomy plays a major role in your answer because it's in your answer is incomplete without the clinical anatomy. Whatever the question is, you should know some clinical anatomy, at least one clinical anatomy related to it. Okay. Then, so I hope you people would have like understood that, because if you are following Vishram Singh, if in every topic there will be a separate box which will be mentioning your clinical anatomy. Okay, if it's about peritoneum, it will be about ascites. If it's about a leg, it will be about like pedal edema, anything let it be, okay, but there will be some disorders or disease mentioned with it related to that structure, related to that topic, okay. You should write that in your answer so that you will be getting a proper full marks. If you are not writing the clinical anatomy, if you are forgetting to write the clinical anatomy, your marks, like, it will be only 2 or 3 marks you will be getting for a question, or else you will not be getting any marks for that question. So it's very important for you to understand the clinical anatomy when you are studying anatomy, okay. So next, actually microscopic anatomy I have 2 times, okay. And apart from this, another anatomy is there where you will be again studying in your first year. It's genetics. I forgot to write it. Genetics. So in genetics, if you are from Tamil Nadu MBBS, like Dr. MGR Medical University, if you are coming under that, you will be having genetics in your paper 2, anatomy paper 2. You have 2 papers, anatomy paper 1 and anatomy paper 2. I don't know about other states medical councils. I know only about Tamil Nadu councils. If you are from other state councils, you will be like having different patterns of paper 1 and paper 2. Many people requested me to like make video in English. Some people are there, so that's why I'm making video in English. If you want this video in Tamil, I can make, no problem for me. So we can have another video in Tamil too. So this is the actual like anatomy. If you want this PDF, you can join the Telegram channel. I'll be posting the PDF in Telegram channel. So I hope everything you got. Gross anatomy is there, developmental anatomy. Apart from this, in BDC, another 2 or 3 anatomy is given, like embryology, evolutionary anatomy, comparative anatomy, something is given, which is not important that much. So I haven't covered that. Okay. So next, what should you know when you are studying anatomy? The must know things. These are the must know things. First, you should know the anatomical positions. Anatomical. What is an anatomical position? That's the reason I'm standing here, because I need to explain things here in this video. I should like explain the things properly by making this, that. I should show you the positions, right? That's why I'm standing here. So, or else I would have took this video in a sitting posture itself. Okay. Next, then names and the regions. Names of the regions. There are like specific regions in our body which have specific names. You should know that things. Then again, planes and sections. You have planes and sections of our body. You should again know that. Then body movements. These are the very important things you should know in anatomy. Apart from that, like regions of stomachs are there. If you want a video on that too, I can make the video on that. If you are covering abdomen, I guess you can study at that time. So then come here. We'll go into the actual part here. So come here. What is an anatomical position? First thing, I'll keep my pen down. So you should be straight, you should be standing straight, and your palm should be facing forward, face should be forward. That's what here it is given. Face should be looking forward. Okay, face should be looking forward. Hands by sides, palm facing forward. Okay, then feet should be together. Okay, feet should be together. This is your actual anatomical position. This picture I took it from Gray's Anatomy. Okay, this picture I took it from Gray's Anatomy. This is your actual anatomical position. Apart from that, other positions are there. If you are sleeping like this position, your hand should be like this. So this straightly, your face should be looking upright. Okay, so it's like that. It's called as a supine position, supine or supine. Okay, it's your supine position. Okay, then I hope so. What's up? This is supination. Okay, what's up? Then pronation. If you are a PUBG player, BGMI player, you can know that you will be proning like this, right? In PUBG and all. That's your pronation. This position is your pronation. Okay, you will be sleeping in this position. So this is your pronation. So this is your supination. This is your pronation. Supine position and prone position. We can tell that if you are doing that here and there, it's called a supination and pronation. Okay, I have explained the movements to here. Come here. What position is this? If you are familiar with some movies, you can know that it's a delivery position, we can say, but actually in anatomy we call it as a lithotomy position. Okay, it's our lithotomy position. These are the three major position you should know. What is anatomical position, what is supine position, what is prone position, and lithotomy position. If you are doing like this posture, if you are doing, it's supination, supination, pronation, supination, pronation. It's movement, it will be coming under movement. I'll be telling that again in moments. Okay, so the must know regions of your body. Come, let's go. This picture I took it from Google. Okay, if you know Dr. Anand Mani, Dr. Anand Mani, he's an like NEET coaching, having NEET coaching, and again he's having Dr. Nest channel. He's a very famous guy in the north side. I mean, in Hindi, he makes videos in Hindi. He also took this picture, and the same picture I'm taking here. I should give a reference, right? That's why I'm saying this. So, when it comes to your head, it's your cephalic. Cephalic means head. You should know this. Cephalic means head. Cervical means neck. Okay, something which is in a shape of a neck is called as cervical. I'll just go with the flow. I'm not going through any definitions here. I don't want to make you bored by giving definitions here. Okay, so this part is your cranial part, the skull part, right? Your face is covered of like formed by skull and facial bones. So skull part is your, the skull part is your, the cranial part. The cranial part is your skull. Then the facial part is your face, you know, I guess. So the whole thing, your head is called as cephalic. So next, when it comes to neck, it's called as cervical. Why the below part of uterus is called as cervix? The just below part of your uterus is called as cervix because it's a like it will be like shape of a neck. That's why it is called as cervix. That's the reason it's called as cervix. If something is in a part like in the shape of a neck, it's called as cervical part. Okay, so that's why it is your cervical region. Next, this part, right? This part, it's your axillary, which is your armpit. So this is your axillary region. Then if you see this hand part, the first part of your hand, here you have brachialis muscle. You have brachialis muscle. So that's the reason it is called as brachial part, which is your arm. This is your arm, this is your forearm. Okay, the forearm, and apart from forearm, if you see this part, you have a region called as cubital fossa. If you have a fossa here where you know venipuncture is done, many injections are being injected here. If you know, if you have gone to hospitals properly, so you should be knowing this part is your cubital fossa. That's why it is called as antecubital. Okay, that's why it is called as antecubital, front of your elbow. This is your elbow region, this is your front of your elbow region. Then this is forearm. You know, you might know this is your forearm. This is also called as antebrachial. Why it is called as antebrachial? Because it is front, it is in front of brachial. Brachial part is it is in front of brachial part. That's why it is called as antebrachial. Then you see your wrist, the wrist region, right, where you are tying your watch here. So wearing your watch, right, this part is called as carpal part. Why it is called as carpal part? Because it comprises of your carpal bones. Okay, this is your carpal part, which is your wrist. Then this is your palm. You should have known that palm or volar part, palm or volar part. Then the fingers are called as digits. That's why it is your digital or phalanges. You should have known that phalanges. This is your phalanges. That's why it is called as phalangeal part. Then come here. The front of your head, right? This part, the front of your head, it is called as frontal, your forehead. Okay, frontal part. This region, right? This region is your temple. This is called as this region. This region is your temple part. That is called as temporal. Again, this is your temporal part. Then I'll go on this side. Okay, then the eyes, right? This is your orbits, so it's called as orbital or ocular. Wherever you are seeing the term ocular, because you have the muscles, oculi muscles there, like that's why it is called as ocular. So it is your eye part. Next, where here you are seeing otic. Otic means ear, so you will be having a ganglion here, otic ganglion, that's why it is called as otic. So it's your otic or ear. Next, your cheek region is called as buccal, because you have buccinator muscle there, so buccal part is your cheek. Then again the nasal part is, because you have nasal bone there, that's why it is called as nasal. The nose part is called as nasal part again. Next, oral muscles are there, okay, so that's why it is called as, mouth is called as oral. So then this part, right, chin, the chin region is called as mental foramen. You will be having mental foramen here in this side, where you will be having mental nerve, that's why it is called as mental, okay. So chin is called as mental here. Then if you are coming here, you you have one bone here, that is your sternum, which like gives attachments to your vertebra, right? So sorry, it's not vertebra, it's your ribs. Just happens, yeah. So it's your ribs, it gives attachment to your ribs here. So it's called as sternal, which is your breastbone, okay, which is your breastbone. Then the chest part is called as thoracic part, which is your thoracic region, okay. You will be having a thorax book, separate book, okay. So it's your thoracic region. Thorax is like chest part is called as thorax. Then you people would have known that the breast is called, also called as mammary, okay. Then this region, right, this region, this is called as your abdomen, which is your abdominal region, and the center is your trunk. You should have known that too. Then the, I can't take my t-shirt and show it, okay. So this part, right, the middle, the knobby, I guess, so it's called as umbilicus, okay. That's your umbilical part, okay. That's your umbilical part, that's your navel, okay. Done. So next, you have coxal, hip. If you are keeping your hands like this, you can feel some prominence there. Yeah, that's your coxal region, hip region. That's your coxal region, okay. I wanted to say something here too. Yeah, here why it is called as umbilical means you have an umbilical ligament there, that's why it is called as umbilical region. That's the reason you are like calling it as an umbilical region. So again the hip is also called as coccyx, so because the coccyx bone is there behind, and other like hip bones are there, you can just go and study in your when you are studying the hip region. So then why it is called as inguinal region, the groin, inguinal region, because you have inguinal canal there, this groin part, right, this groin part is, it is also called as inguinal region because you have inguinal canal there, okay, inguinal canal, that's why it is also called as an inguinal region. Then the pelvic, the pelvic is also called as, the pelvis is also called as pelvic region. You have the pelvic muscles and pelvic bone there. Then if you are going to a thumb is also called as pollex. When you are studying upper limb, you will be going like you will be not familiar with with these terms. There will be some muscles called as flexor pollicis longus, flexor pollicis brevis, extensor pollicis. The term pollicis refers to the thumb. If you are like seeing the term pollicis, you should understand that that muscle is responsible for the movement of the thumb. Okay, you should know this. So then the genetic part, like sorry, genital part is called as pubis here. So pubic is your genetic part, not genetic, yeah, it's genital part. Okay, so it's your pubic region. Then so apart from this, you have other things too. If you are going through your thigh, the thigh is also called as femoral region because you have femoral artery, femoral nerve, everything there, femoral vein too. So that's the reason the thigh is also called as a femoral region. Then if you are going here, knee, right, the anterior surface of knee, it's also called as also called as, I just wait for 5 minutes. After completing this, I'll be saying what is anterior, what is posterior, what is ventral, what is lateral, what is medial, what is superior, what is inferior, everything I'll say. Wait just for 5 minutes. Okay. So if you see here again, the knee, anterior surface of knee is called as patellar surface because you have a bone there called as patella. Okay, it's also called as a patellar surface. Next, the leg is called as crural surface. The ankle is called as the tarsal one. Then digital or phalangeal again. Okay, then foot is called as a pedal. This is your anterior view. What do you mean by anterior view? The front part, wherever you are, like first thing you are seeing, right? The front. That is your anterior view. That is your anterior view. Again, the great toe is called as hallux, and when it comes to your foot, this part is your dorsum. Okay, this part is your dorsum, and this is your plantar surface. You should know that top of foot is your called as dorsum of foot. When it comes to your like behind of your foot, right? Can't show like this. Just forgive me. So the behind part of your foot, right? It is your plantar surface. So come here. You can go for the posterior view. If you are turning behind, if you are seeing from the front, this is your anterior view. That is your posterior view. Okay. So we can go again. Again, this is your cephalic part. Yeah. This part, right, base of the skull. This is your occipital region. So you have occipital bone there. Then this part, the shoulder part is also called as acromion because you have acromion process there. Okay, acromion. Then again the behind part, this part, right? Here you have a bone called as scapula. You have a bone called as scapula here in this shoulder blade, this right, this region. So that's also called as scapula. Scapula. Then again you have a spinal vertebral column in which spinal cord is traveling inside. So this is your vertebral part, and back is also called as dorsal part. That's just now I told you. Then if you are seeing this part, back of elbow, right? It is also called as olecranon or cubital part. This part was your anti-cubital. This is your cubital. Okay. This was your anti-cubital. This is your cubital. It is also called as olecranon because you have an olecranon process there. That's the region. That's the reason. Then again, if you are turning behind and touching your base of your back, there you have sacrum. That's the reason it is called as sacral region. Then again, this part, right, the behind part, you have lumbar part of your vertebra. That's the reason you call it as a lumbar part. So this is your lumbar or loin. You can also say as a loin. When you are having that renal calculi in these conditions, you will be having pain in the loin because it will be mentioned in the book, pain in the loin. So here the loin region also called as a lumbar region. Okay. So next, if you are seeing that the tailbone, the tip of your vertebral column, that the coccyx will be there. So that's also called as coccygeal regions. Then again, where you see the buttocks, right? This part is your gluteal part. Okay, gluteal part. It is also called as a gluteal region. The line you are seeing there, right? The line here. This line is your gluteal line. Okay. Then this part, right? The inside part. It's also called as perineum. Okay, perineal, the region between anus and the external genitalia. If you are seeing, I'll just explain it. This is your anus. This is your anus. This is your external genitalia. Ending of your external genitalia. The part between the two part, right? The part between your anal opening and your external genitalia. The in between part is called as your perineum. Okay, you have perineal muscles there. Then again, this part is also called as popliteal because you have a fossa called as popliteal fossa. There you have where you have popliteal vein, popliteal artery. So that's the reason it is called as popliteal. You can just touch your behind of your knee. You can see one fossa there, a depression. That's the reason it's called as popliteal. That region is called as popliteal fossa. The fossa is called as popliteal fossa. The region is called as popliteal region. Okay, again the calf is called as crural. Okay, The sole is called as, sole means the behind of your, the soft part of your foot, right? The behind where you walk, that's your sole. It's called as plantar. That's your plantar. Again, this part, right? The the heel is called as calcaneal part because you have a bone called as calcaneum there. Okay, that's the reason it is called as calcaneum. And when it comes to your hand, this is your dorsum of hand. Okay, this is your dorsum of hand. I hope you people would have got what I said till now. If you are having any doubts regarding this, you can comment down. I'll explain that. And if you want any other videos regarding physiology or biochemistry, you can say in the comment section. I'll be making videos in that. So I hope my English is not that bad. So we can go into the planes now. The major planes you should know, must know planes are there. So before that, you should know anything which is upper, which is on the upper side towards the head is called a superior. Okay, this is your superior. This is your superior part. The upper part is called as a superior part. Then the lower part, right? This is your inferior part towards the legs, towards the limbs. Okay. So next, I will explain you the planes here. If you are a human, you're taking anything, you're taking anything and cutting that into a straight in this, like this, to two halves. It is your coronal plane. Okay, it is your coronal plane because you're cutting in the mid axis. Okay, this is your mid axis. If you are cutting it in a mid axis, it is your coronal plane. Just see here, this is your coronal plane. This is your coronal plane because it's your cutting body into the mid. Then, if you are cutting it in this half, the side half, right? This like this. Wait. You are cutting it in like this to two halves, passing in between your hands and in between your body. It is your sagittal plane or sagittal plane, whatever, sagittal or sagittal plane. These are the two major planes. Another plane is there. If you are cutting the body into two halves in this region, this is your transverse or horizontal or axial plane, this hip region. Okay, you are cutting the body into two half, upper half and lower half. There are a lot of definitions for this in your book. If you want, you can just go and read those definitions. If you have not followed me in Instagram still, I'll give the Instagram link down there because I'm going to make a PDF of your first year book. Whatever books are there, Grey's Anatomy, Vishram Singh, BDC, CK Paul, Sembulingam for physiology, then Harper for biochemistry, Vasudevan for biochemistry. Every book out there in the market, I'm going to give you a PDF of that. So if you are not following me on Instagram, you follow me on Instagram so that you will get so that you will get those PDF in Instagram. Okay. So then another thing, anterior part, posterior part behind. Okay, then again medial and lateral. I'll explain this again, medial and lateral. Wait a minute. Okay, so come here. Anterior is also called as ventral. This is your ventral side of your hand. Okay, this is your ventral side of your hand. This is your dorsum of hand. This is your ventral side of your hand. Okay, so dorsal is also called as posterior. Posterior is also called as dorsal. So you should again know these terminologies here. So ventral and dorsal. So ventral or anterior, dorsal or posterior. What do you mean by medial? Anything which is near to your midline. I said you, this is your midline, correct? This is your midline. So anything nearer to this midline is your medial. If it's going behind, like in distant, okay? If it's going very far from the midline, if you are seeing that your hand, the palmar region is lateral to your sternum. Of course, it's correct, right? So it's very far from your midline. So from sternum, it is very far. So it's lateral from your sternum. You can define like that. So when it comes to the midline, you should understand this term. Medial is something which is nearer to your midline. Lateral is something which is far from your midline. Okay. Again, I'm saying medial is something which is nearer to your midline. Lateral is something which is far from your midline. I hope you people would have understood that. That's what this diagram is also saying. Medial is something which is like going near to your midline. Lateral is something which is going away from your midline. Okay, I hope so. People would have got this. Suppose if you are taking this is your you are taking this part as your like reference point. Anything near to this point is your medial. Anything like far from this point is your lateral. That's the only thing you should know here. Apart from that, nothing is important here. Then medial and lateral both over now. Okay, lateral. What do you mean by proximal? Proximal is nothing but where the point starts. Where the point starts, because if you are seeing this is your hands, fingers, right? This finger is starting from here. Okay, this finger is starting from here. This is the root of the finger. I'm just saying you something. Just get it. Okay. Just try to understand the terms I'm saying. This is your, if you are considering it as the root of your finger, the root, right? The root portion is your proximal part. From the root portion, if you are going far, this is your distal part. So this is your proximal part. This is your distal part. That's called as proximal and distal. Also, it is called as cranial. What do you mean by cranial? Again, the cranial is the top part is your cranial, which is a proximal for the whole human body. So taking the whole human body, this is a proximal part because the body is starting from here. When you are going for the caudal, what do you mean by caudal? Caudal means tail. The coccyx region at the tip or down is your caudal part. That is also called as the inferior one. So distal, proximal. Sorry, proximal, superior, and cranial are the same. Then distal, caudal, and inferior are the same. This is not said by me. This is said by our BD Chaurasia. It's given in BDC. You can take and see. Then, what do you mean by superficial? Anything which is the surface of the skin. If you are seeing it is in the surface of the skin, it's a superficial. That's why it is surface anatomy. If you are seeing surface anatomy, it's your superficial anatomy. So then it's deep means like inside the skin, away deep inside the skin is called as deep. Okay. So then, what do you mean by ipsilateral? Ipsilateral means, for example, if you are taking one reference point, if some structure is on the same side of the reference point, okay, on the same side of the reference point, it's called as ipsilateral. Okay, I hope so you would have got that. For example, one nerve is traveling from this side. Consider one nerve is traveling from this side and its signal is going to the same side of your brain, called as ipsilateral. But one nerve is traveling from this side, but its signal is going to another side of the brain, means it's called as contralateral. Only term you should understand here. Because ipsilateral and contralateral you will be seeing in physiology. Okay, so ipsilateral, same side, I'll write it here. Same side of an structure, opposite side of a structure. Of a structure. Then invagination. If it's going something you are seeing, it's going like this. You are taking this cloth, it's going like inside. If you are like say here in exam, you are seeing this cloth, it's going inside means it's invagination. If it's coming out of that surface, it's evagination. Or yeah, both are correct. So invagination and evagination. You should know these terms. Apart from this, no other things are like important things are there. So I hope so everything I covered. So then movements are there. Know the movements too. I'll post this PDF in the group as soon as possible. So then when it comes to movement, if the two surfaces are meeting like this, the same side surfaces are meeting like this, it's your flexion. If you are doing this action in your hand, this is your flexor compartment, this is your extensor compartment. Flexion is this for your hand, I'm saying. Flexion is this. For your body, if your flexion, how will you do flexion for your body? Just see here. This is your flexion. Because two surfaces of the same side are meeting, right? According to BDC, this is the definition. Two surfaces of the same side should meet together. So this is your flexion. If you are doing like this, extension, you are in extension position, extended position. Okay, this is your flexion for hand, this is your extension for your hand. Flexion, extension, flexion, extension. Then what do you mean by abduction? Abduction is nothing but your limbs should go away from your body. This is your abduction. Okay, this is your abduction. If your limbs are coming nearer to your body, your limbs are coming nearer to your body, this is your adduction. Okay, so it is an adduction position. You are standing in adduction position. Okay, adducted position. Now if you are doing this, this is your abduction. The term will be confusing, many people will be getting confused with this term. Abduction, adduction, abduction, adduction. Okay, so next, what do you mean by circumduction? I'll show you the images too. Don't like actually that much. I don't have that much belief in the images. That's why I'm doing and showing it. So see here, circumduction. Maybe with this more videos, my English will get better probably. More flow I will get probably, I guess. I hope so. The English is not that much bad. Hope everyone is understanding my English. If you are like finding any faults or difficulties in understanding my English, you can just comment down in the comment section. I'll try to change that. Okay. A very basic Indian English I'm speaking. The Indian, how Indian people speak, that's a thing here. So circumduction. If you are doing this, this is your circumduction. You are rotating your hand. That's the only thing you are doing here. So this is your circumduction. Okay. What do you mean by medial rotation? If you are taking your hand like this and rotating it inside, medial side. I say it right. If you are going inside, far nearer to your midline, it is medial position. Far from your midline, it is lateral position. That's the only thing you need to know here. If you are going this side, nearer to your midline, it's your medial rotation. If you are rotating your hand at this side, this is your lateral rotation. I hope you people would have got this too. So flexion, extension. I forgot to say about your head. This is your flexion of head. This is your extension of head. Flexion, extension, flexion. Okay. Sorry. Oh, sorry. In between Tamil, I got some Tamil. This is your flexion. This is your extension. Flexion, extension. While it comes to leg, I can't show probably here. If you are extending your leg like this is your weight. I'll show that in an image. Okay, so that you will get it. Then supination again. Supination, pronation. Supination, pronation. Supination, pronation means you are going like this. Okay, in an talagila manner. Oh, what can I say that in English? Oh my god. Then opposition of thumb. What do you mean by opposition of thumb? You're taking your fingers like this, your thumb is touching this finger, right? Any finger is touching. You're touching any finger of your hand, like palm, whatever. Oh, sorry. So see here. Oh, sorry, I'm getting a lot of Tamil words in between. Okay. So if you're doing like this, it's your opposition. Okay. It's your opposition. Then circumduction of thumb. This is your circumduction of thumb, where you will you will do every action, flexion, extension, abduction, everything you will do. Okay. When it comes to fingers, this is your abduction, this is your adduction, abduction, adduction, abduction, adduction. When it comes to fingers, yeah, what I said is here. This is your flexion. While it comes to your leg, if you are bending your legs like this, that's your flexion. You're normally standing in an extended position. Okay, that's your extension. Yeah? I hope so. You people would have got this. Then this is your flexion. This is your extension. This also I have already said, right? This thing. Next, again from your trunk, through your trunk. If you are doing this, this is your flexion. If you are going behind, it's your extension. Abduction, adduction already I told. And if you are doing this, this is your rotation again. Okay. While it comes to your leg, if you are taking your leg away from your body like this, okay, like this, you can't see my leg, of course. This is your abduction, and if you are bringing it again nearer, it's your adduction. If you are like doing your legs like this, this is your medial rotation, this is your lateral rotation. While it comes to your your dorsum of foot is there, right? If your dorsum of foot is coming like this, it's your dorsiflexion. Okay. If your sole is going like this, it's your plantar flexion. Understand this term because it's very important. Again, your foot is going like this, it's inversion. Your foot is going like that, it's eversion. Okay. Maybe these things you will again learn in your first year, like the medical college starting. Maybe you will have foundation classes for 1 week. After that only you will be starting with your course, actual course. So for the first at least 3 to 4 days, you won't be having any classes regarding anatomy, physiology, biochemistry, because you'll be having foundation classes most probably. Okay. Apart from that, supination, pronation. Yeah, this also I have said. Supination, what's up? You wanna see what's up? What's up? This is your supination. This is your pronation. Okay. Then opposition also I have told you. Here, yeah, protraction. This one. Okay. Protraction means protrude your tongue. Protrusion of tongue is seen in Down syndrome. You would have heard in principles of inheritance and variation lesson. It's yeah, you are bringing your cheek like this. It's called as chin. Sorry, chin. It's not cheeks. It's chin. If you are bringing it like that, it's called as protraction of your mandible. And if you are taking it inside, it's your retraction. Then again, it's depression and elevation. Two terms are there. Elevation and depression. Elevation of mandible. This is your mandibular region, right? That's why it is called as mandible. Okay. I hope so. You would have enjoyed the video. You have not understood any part in this, you can just comment down, or else message me in Telegram. I'll explain that properly. Apart from that, if you have not subscribed or liked this video yet, do like and subscribe and share to your medicos friends who are going to MBBS this year. All the best for your MBBS career. Congratulations for your medical career. So thank you so much. Hope you guys and drop some comment for this video. How was the video? If you are finding any mistakes in this video, you can comment down and say that. I'll try to rectify those mistakes. And if you didn't understand my English properly, you can also say that. Of course, I hope that, because I saw a comment last time which was describing like you don't even know properly to speak something. So I am just worried about that. So if you are finding any mistakes and if you want me to correct in my videos, you can just say. Then next, what video you want? I can just say the parts of your stomach, I guess. 9 quadrants of stomachs are there. This is not a perfect line actually. Right? This is not a perfect line, just I'm saying, just for a rough thing, I'm doing this. This is your umbilicus region. Actually, this should come here. Yeah. This should come here. This line should come here at this point, connecting the anterior superior iliac spine. Both anterior superior iliac spine. This is the actual line I just took for a rough work. This is your epigastric part. This is your umbilical part. This is your hypogastric part. Okay, epigastric, umbilical, and hypogastric. This is your right iliac fossa, left iliac fossa, right lumbar, right hypochondric, left hypochondric. We're studying this again. I'm just for completion purpose of this video, I'm saying this. So this is your umbilical region. This is your epigastric because you have gastric like stomach there, right? So it is your epigastric. This is your hypogastric. This is your you have costal cartilage there. So that's why it is called as hypochondric. Chondric means cartilage. Right hypochondric, left hypochondric. Again here right iliac fossa, you have iliac fossa there. So ilium is there, right? It's called as right iliac fossa, left iliac fossa. So thank you so much guys. Thank you. I hope you could have enjoyed this video. If you have liked this video, just like the video and comment. Do tell share your views in the comments. Thank you so much. Bye bye. Until